How do you interpret a fibrosarcoma pathology report? Imagine opening a detailed report after a biopsy and trying to understand what it all means. Interpreting a fibrosarcoma pathology report can seem complex, but breaking it down helps clarify the diagnosis and guides treatment decisions. Fibrosarcoma is a rare, aggressive cancer that develops from fibroblasts, which are cells responsible for producing connective tissue. The report provides essential information about the tumor's nature, behavior, and extent. First, the report will identify the tumor type. For fibrosarcoma, this means the tissue shows malignant fibroblasts, which are cancerous cells that produce collagen. Under the microscope, pathologists look for specific features, such as the shape and arrangement of the cells. They often use special tests called immunohistochemical markers. One common marker for fibrosarcoma is MUC4, which is usually positive, helping confirm the diagnosis. The absence of markers for other tumor types also supports this diagnosis. Next, the report will include the tumor grade. This tells us how aggressive the cancer might be. The most common system used is the French Federation of Cancer Centers Sarcoma Group Grading System. It looks at three things: how much the tumor cells look like normal cells, how quickly they are dividing, and how much dead tissue or necrosis is present within the tumor. These factors are scored and combined to assign a grade. G1 indicates a low-grade tumor, G2 or G3 are high-grade, and GX means the grade cannot be determined. Most fibrosarcomas tend to be high-grade, which means they are more likely to grow quickly and spread. The report also discusses the amount of tumor necrosis, or dead tissue. If more than half of the tumor shows necrosis, it can be a sign of a more aggressive tumor. If the patient received chemotherapy before surgery, the report will note how much of the tumor was destroyed by treatment, indicated by the percentage of necrosis. A higher percentage suggests a better response to therapy. Other details include the size of the tumor, how deep it is in the tissue, and whether it involves nearby structures like nerves, blood vessels, or bone. The report will also mention if the cancer has spread to other parts of the body or if it has come back after treatment. Surgical margins are important too. If the tumor was completely removed with no cancer cells at the edges, it is called a negative margin. If cancer cells are present at the edges, it is a positive margin, which may mean additional treatment is needed. Finally, the report might include results from additional tests, such as molecular studies, to confirm the diagnosis or rule out other similar tumors. All these details help doctors decide the best course of action and give a clearer picture of what to expect. In summary, understanding a fibrosarcoma pathology report involves looking at the tumor type, grade, amount of necrosis, size, depth, involvement of surrounding structures, surgical margins, and extra test results. This comprehensive information is vital for planning treatment and predicting outcomes. Always remember to discuss the report with a healthcare professional who can interpret these details in the context of your overall health and specific situation.